Hi everyone. Most of the students they revise the common drugs and during the final revision they miss the newer drugs. So these newer drugs have high chances of being repeated in the INI-CET exam. So let us discuss this new drug update. If you are coming to my channel for the first time, then subscribe my channel first. And if you have not watched the previous new drug update series 1, 2, 3, 4, then watch it now, and the link for this new drug update part 1, 2, 3, 4 is in the description. So let us begin with the today's session of final revision. So gastrointestinal drugs, lorcaserin. So this is a 5-HT2C agonist and these drugs suppresses the appetite. Now how you can remember, SER stands for serotonin. So this is a serotonergic agonist. So these drug you can use in the obesity for weight loss. Then another drug is vonoprazan and tegoprazan. So these are the PCAB blocker, potassium competitive acid blocker. Advantage of these drug are they are faster acting as compared to the proton pump inhibitor, and these operates independent of the meal time. So this is the biggest advantage of this group of drugs. So these drugs you can remember present are the PCAB, potassium competitive acid blocker. Now setmelanotide, this is a melanocortin agonist and this is used in obesity with the Bardet-Biedl syndrome. So there is a mela in its spelling, so that stands for melanocortin agonist. Lubiprostone, this drug activates the type 2 chloride channel, so this increases the fluid secretion in the intestine. Prucalopride, this is a 5-HT4 agonist that is used in the constipation. See in its spelling there is a C which stands for constipation. Tenapanor. So tenapanor is a sodium hydrogen exchanger NHE inhibitor for constipation. So in its spelling you can see there is a Na. So Na stands for sodium hydrogen exchanger inhibitor. Now coming to the drugs for the immunology and rare diseases. So these include dupilumab. These drug inhibits the interleukin 4 and interleukin 13. So mnemonic is it is a dupil. Dual means dual interleukins are blocked, interleukin 4 and 13. And this is used for the chronic urticaria. So in its spelling there is a U, so that stands for urticaria, and it starts with the D, so it is used in the atopic dermatitis. Now another drug is a secukinumab. So this is a interleukin 17 inhibitors. So it starts with the S, so it's a 17 inhibitor, and this is used for psoriasis. Now here if you keep the P silent, then it is psoriasis. So S stands for psoriasis. So this is how you can remember. Then mirikizumab. So mirikizumab is an interleukin 23 inhibitor and this is used in the bowel diseases. The first two letters M is it 2 times in its spelling and I is 3 times in its spelling. Okay, interleukin 23 inhibitor. So this way you can remember what is its target. Another drug is fitoruciran. So siRNA that decreases the antithrombin which will ultimately promote the clotting. So this drug is used in the hemophilia A and B. So in its spelling you can see there is a seran, so that stands for siRNA. So fitoruciran acts on the siRNA that decreases the antithrombin. So this is used in the hemophilia A and B. Now another drug is a nipocalimab. So this is a FC receptor blocker. So this is used in the myasthenia gravis and hemolytic diseases of the newborn. So in the newborn, nipocalimab. So N stands for hemolytic diseases of the newborn. It is a FC receptor blocker. Now another very important drug which is approved by US FDA in just May 2026, that is the anti-cancer drug, and that we will discuss, and the name of the drug is vepdegestrant. So this is similar to the fulvestrant and this is a selective estrogen receptor degrader, SERD group of drug, and you can remember this EST stands for estrogen, then R estrogen receptor, and DEG that stands for degrader. So it is a SERD. Now these drugs directly target the mutant estrogen receptor and these will promote their degradation. Remember, it's a not blocker, it causes degradation. So these drug is used in the ER positive, HER2 negative, advanced metastatic breast cancer and ESR1 mutated breast cancer. So these patients who have progressed after at least one endocrinal therapy, hormonal therapy, these patients are the candidate for this drug. Now advantage, this can be asked in the exam as compared to fulvestrant. Fulvestrant, remember, it is a given by parenteral intramuscular injection, while this drug which is recently just approved in the May 2026, so there are high chances of being asked this drug, vepdegestrant, this is given by oral route. So that improves the compliance of the patient and feasible for the patient. So this was about the latest update. So if you found this video helpful, then subscribe my channel and follow for more pharmacology related videos. Thank you.